So I practice natural thing. I would ask people to like don't eat white sugar. Rather, you should switch to the natural thing. Maybe a date something you can add it in your, as a substitute in your sweets or something. So going with a very natural thing, I would suggest. I might give the recipes to my client. So first
Okay.
of all, welcome to Optima Remedy, ma'am. Thank you so much for joining and taking a part in awareness session because November is a diabetes awareness month. And yes, before we begin, I'll just introduce you. We have Dr. Anushree live with us. She's a renowned diabetologist in Mumbai, and I cannot tell you that how excited I am to host this session because when the post went live there's so many DMs on my personal account, and the people were like, "Oh my God, Dr. Anushree is there." They were already excited to hear you out. So yes, this is very great opportunity for me to ask you questions and aware people on Optima Remedy. Um, we might also address the questions from the audience, but yes, the questions which we have already got to make awareness are a couple of, as you already know, India is the leading in diabetes. And
Yes.
what I actually wanted to know is like what age range of patients you observe in your clinic or in your practice?
So, first of all, thank you, Optima Remedy, for having me or for this Instagram live session. And I think November being the World Diabetes Awareness Month, we take as many opportunities as we get to create awareness about the condition. As far as India is concerned, then India is the second leading country in the world as far as diabetes is concerned. And generally, if you go by the world standards, anybody above 40 years of age is at risk of getting diabetes. But what we are seeing in India is that a lot of young people, people who are in their 30s, are actually developing new onset diabetes. And the last 2 years of COVID have played a havoc. So it's
Yes,
not just the COVID in itself, but the online working, the sedentary lifestyle, how everybody was completely stuck in their houses for 2 years. And with the IT boom, people working continuously on their laptop for 12 hours with no exercise, we are seeing a lot of young people with new onset diabetes. So, in fact, in India, there is a little bit of a movement among doctors where we are saying that screening for diabetes should start as early as 25 years, because we are seeing, people in the 30 to 35 of age group develop pre-diabetes and diabetes. So,
yes.
especially for India, the beginning is a little younger compared to other countries.
Mm-hmm. True that. And being India has the largest population of the young people, it has been
Yes,
observed that these days young people are getting diagnosed more with diabetes.
yes.
Sadly, we all know that diet is one of the aspect of getting the reason of diagnosing the diabetes. But what are the other reasons you find it which are more common in the younger age group?
So you are absolutely right that the primary reason is unhealthy eating, but you add physical inactivity. And when I say physical inactivity, I don't mean exercise. I mean literally physical inactivity. People are just sitting in front of their laptop continuously for 8 hours straight, you know.
True.
So you become your people are becoming extremely sedentary. Second is the stress levels, because we are a booming economy, we are a growing economy, and there is a lot of new products coming in. There's a lot of peer pressure. There's a lot of job stress. So all the youngsters, they have so much to do in life and so much to achieve that they put a lot of pressure on themselves. So they forget everything else, and career is becomes the center point, and everything else in life takes a back seat, including health.
Yes.
So the stress affects their health. Stress increases risk of diabetes. A lot of young people, although the overall incidence of smoking has gone down, but we are seeing a lot of young college going students who, earlier was not seen. But now we see a lot of young, even girls, boys, they smoke in
Hmm.
college. Smoking increases the risk of getting diabetes. So, smoking in youngsters has increased, although overall the use of cigarettes has gone down.
Yes.
So that is another reason. And well, I think this is not the place, but Swiggy and Zomato are to be blamed in a lot of ways for the increasing incidence of diabetes.
When we like the client for a lifestyle thing, we are asking them to do like delete these two apps from your phone first and then enroll yourself in this program so that we can clean with the journey. So that's something which really must. Um, in today's awareness session, I would say this is the takeaway thing to like just delete the Swiggy and Zomato from your phone. Otherwise, you will be always getting into the unnecessary eating. So that's something to be keeping in mind to like begin your journey for a healthy start. Yes, so you have said that you've been observing a lot of change in the trend. I believe that when I started practicing at the beginning, when middle age patients used to come and they used to like be very worried that they have been diagnosed with diabetes, and that attitude was there. But now, if you see that the young people getting diagnosed with diabetes, they are like least bother. Okay, sabko hota hai. This kind of attitude is also there. So, what are you observing in your practice? What is their knowledge and what is their attitude and what is their practice?
So, a lot of young people, when they get diagnosed with diabetes, it's a very life changing moment for them because they are
True.
so used to only focusing on career. They don't have to think about food, they don't have to think about weight, they don't have to think about health because nothing has ever bothered them before, you know, and they are a little too young to be worrying about health, very honestly speaking.
True.
So, their attitude is casual. Maybe you can say that their attitude is casual. There are a group of people who are very overconfident that we are so healthy, what will happen, and then there are a group who are completely in denial. तो हम शुगर चेक ही नहीं करेंगे तो हमको पता ही नहीं चलेगा कि शुगर हाई है, तो हमको कुछ करने की जरूरत ही नहीं पड़ेगी, you know.
True.
So it's a typical, denial phase where they don't want to think about the diabetes, they don't want to accept their diabetes. Unfortunately, it's not going anywhere soon. So yeah, there are different kinds, and then there are those who become extremely focused. I
Hmm.
mean, you also must have seen, very aware, very motivated, and they'll follow everything to the T. So we
True.
have, and then there are those who are extremely anxious also. That,
Hmm.
oh my God, I'm so young. Why have I got diabetes? What will happen now? You know, these medicines will damage my kidneys. This will happen, that will happen. But they don't realize that the medicines don't damage the kidneys. Diabetes can damage the kidneys.
Yes. Yes. True that. The uncontrolled diabetes can damage the other organs in the body. So the basically we don't want it to like get afraid of diagnosis and not getting into the treatment mode. We need to accept it rather than being anxious. So that's something we really need to take care because that anxiousness in that particular time duration can really elevate the sugar level. So that's something we really don't want. We wanted to control it. We wanted to manage it, and it's easily manageable. So nothing to worry about. As you have said that we know that the audience on our Instagram page is very young. So you have said that they don't wanted to get a test. They don't wanted to test their blood and they don't wanted to get diagnosed as such. So what I wanted to like address is like what are the common symptoms which the young population should not ignore or should not neglect just because they are afraid to get diagnosed with diabetes.
So I will mention the symptoms, but before I go there, what I would like to say is that diabetes is a silent disease.
Yes.
In majority of the patients, it does not produce any very, very prominent symptoms.
Hmm.
Okay. So there are a lot of times we get patients with accidental reports and they have absolutely no complaints. So, I mean, yes, I will elaborate on the symptoms. If you have the symptoms, you have to get tested. But if
Yes.
you don't have the symptoms, does not mean that you don't have to do your annual screening for diabetes. So, the very common symptoms of diabetes that we see, and we are talking about type 2 diabetes today, that we are seeing is one is fatigue, you know, a very vague fatigue that people feel. They just don't feel that they have energy, they feel very lethargic. Okay.
Hmm.
The others that are commonly available on the internet is you have to go to the bathroom frequently, so frequent urination, you feel
Hmm.
thirsty all the time. Okay, so today only I had a newly diagnosed patient. He said that my mouth feels very dry when I go to sleep. So
Yes.
dryness of mouth. Okay.
Hmm.
Then some people don't develop anything. They only get fungal infection. And the fungal infection just doesn't get better in spite of repeated treatments. Again,
Hmm.
that is because of diabetes. Then any small wound that is not healing, then you need to check your sugars. Okay. And if you've gone to a stage where your sugars are very, very high, then patients even come with weight loss, which
Hmm.
is contradictory because diabetes occurs because of weight gain. But if
Again.
you've
Yes.
crossed over to a stage where your sugars are extremely high, then your body starts wasting and you start losing muscle and you start losing weight. So that
Hmm.
is the, that is the stage that, okay, this at this stage probably the sugars are in the range of 300 plus.
So
But majority patients don't get symptoms. So if you have a family history, you should test every year starting from the age of 25.
wow. So that's a good insight because these are very common symptoms and people often neglect it. So it's very rare that okay, I'm getting a dryness in mouth. That's not something I should take it as seriously as I should.
I'll just go
So,
drink water. So
yeah.
you don't realize, but yeah.
Yeah. Yes, true that. So that is something we need to take care by just saying that मुझे बार बार भूख लग रही है, बार बार प्यास लग रही है, ये सब normal हो रहा है. It's not actually normal. We need to take things very seriously at a point because if the sugars are really uncontrolled, जो आपको डर है कि भाई मेरे organs को इफेक्ट होगा वो हो जाएगा if you're not getting into a right treatment at the right time. So that's something we really need to take care of rather than being anxious and rather than being afraid of getting diagnosed. Um, so that we have spoken so much about it, I also want you to speak about reversal of diabetes because we have been like continuously speaking about diagnosis, and reversal of diabetes is something very, very trendy these days, and it's happening also. It's not like it's not happening, but have you seen that the journey of reversal of diabetes, or I would not say reversal, it's re-emission, right? The re-emission would be the correct word to
Remission,
put
yeah.
there.
So yeah, so there is something called as remission, and then there is something called as reversal.
Yes.
Reversal is if you have had diabetes and then whatever you go through the process and your sugars normalize, you stop taking medicine and your sugars remain normal without medicine for at least 5 years,
Hmm.
then we say that the diabetes has reversed. But I
Okay.
think what we are more commonly seeing is remission. So
Hmm.
remission is especially in newly diagnosed patients if they follow very aggressive lifestyle modification, or if you have obese patients who lose 10 to 15 kgs of weight, we are seeing that they go completely off medication and they do manage normal sugars, but the risk of diabetes always remains. So
Yes.
if somebody who's lost 15 kilos and is off diabetes medication, if tomorrow he starts gaining weight, he will probably the diabetes may come back. So the risk of diabetes will always remain, but you can, with a healthy lifestyle, be off medication, and you still have to do the screening, and you still have to follow the healthy lifestyle. Otherwise, reversal is a very big topic, so I'm just going to just touch upon it briefly, considering that I'm sure you want to ask a few other questions. So
Yes, yes, we are getting questions on
the
the
earlier you target for reversal, or remission rather, the higher the chance that it will be achieved soon
yes,
after
yes.
diagnosis. The longer you wait, the more difficult it becomes.
True that. So early diagnosis, maybe reversing the pre-diabetes is much easier than getting diagnosed with diabetes.
So even if you're not able to reverse the pre-diabetes, remaining in the stage of pre-diabetes is also doable, You'll never cross over if you just keep following a healthy lifestyle. So your
That
risk of
that
complications is still not there, right?
that's true. That's so true. And being in pre-diabetes rather than like going neither this side nor that side is still a good progress to hold on. Yeah. So we're getting few questions. Can newborn baby inherit diabetes if family have diabetes history? So, like, I feel this is,
So yeah.
yeah.
So if type 2 diabetes runs in the family, then the newborn baby is at a risk, not while he's a child, but when he becomes an adult or once he crosses puberty, he
Mm-hmm.
is at a risk of developing type 2 diabetes. But what research has shown is that the environmental factors, the environment is much more responsible than the genetics for
Okay.
diabetes. So even if you
Mm-hmm.
have a risk of getting diabetes, if you follow healthy lifestyle, healthy eating, regular exercise, if the child doesn't is normal weight, then his risk of getting type 2 diabetes can be elevated. But the environmental factor is stronger than the genes. So the
True that.
genes may confer a risk, but the environment is also very important.
Environment, which includes everything. So this is something called as epigenetic, which is affecting your genetic model because of the environment. So that's
Yes.
something very true that in spite of you have the risk, what I suggest, even if you don't have the family history or you have the family history, you should follow a healthy lifestyle. So that's something need to be done as per rule, I believe. All right. So, do sugar-free tablets have side effects? So, this is the question we have got.
This is more a question for you. But sugar-free tablets, in the amount that is recommended,
Hmm.
or the amount of sugar-free tablets that can cause toxicity is very, very high. So if you take it in small amounts, they don't have side effects. But I think you would be a better person to answer this.
Sure. So, sugar-free is basically, in the end, it's a chemical, right? And there are a lot of research which has said that putting chemical in your body might lead to the other side effects. Maybe long term, if they are taking it in excessive amount, can lead to cancer as well. So, I practice natural thing. I would ask people to like don't eat white sugar. Rather, you should switch to the natural thing. Maybe a date something you can add it in as a substitute in your sweets or something. So going with a very natural thing, I would suggest. I might give the recipes to my client that okay, instead of this take this. So that's something. One pro tip is here, there are diabetic patients, there are patients who have diabetes who has a sweet tooth. So I ask them to have one spoon of soft instead whenever they are like craving for sweet. So soft basically helps to reduce that sweet craving, and they are not getting indulged into these sweets which has the white sugars in it. So I
Oh,
might
I
give rest.
really didn't know that. So soft helps to reduce the craving. I'll try
Yes,
that for myself.
yes,
Then.
yes, yes. You can give this tip to your patients because that's really helpful. Basically after
I didn't
exactly
know that.
after the meal. Exactly after the meal, they get the craving for having something sweet as a dessert or something. So this can
Yes.
help for a better digestion and to reduce the craving as well. So this is a very good thing to incorporate.
Nice, nice. This was something I learned from our live session. Okay.
Yes. Thank you so much. So we have too many questions coming up. Can we take Ayurvedic medicine and allopathic together?
So, well, I am an allopathic doctor. I don't know anything about Ayurvedic medicines, in spite of the general belief, about. So we have no idea about Ayurvedic medicines because it's everything is in Sanskrit. Even if I want to gain the knowledge, it's very
Yes.
tough.
So,
Uh, so I would just like to say here that Ayurvedic medicines are not free of side effects. Point one.
hmm,
They do have their own set of side effects. Okay. Point two. When you're taking an Ayurvedic medicine from a Ved, you should always let him know that you are on allopathic medicines for diabetes. And sometimes in some patients, the Ayurvedic medicines, if they show an effect, you may develop low blood sugar. And in
yes,
that situation, you may have to either cut down the allopathic medicine or the Ayurvedic medicine. So you should continuously be in touch with either of your doctors. Otherwise, you will land up in the hospital with a low sugar.
yes.
Okay. Besides that, are there any interactions between allopathy and Ayurveda medicines? We don't know. Nobody
Hmm.
knows because that has not been studied.
True that. So I would just give you one live case example which I have seen when I was doing the internship at Nair Hospital. I have seen that one patient has been got admitted in the ICU just because that patient was on both the treatment, Ayurvedic as well as the allopathy. I don't know, the Ayurvedic was not so authentic, and it has like led to some of the side effect, and there was an organ failure. So this is something the live example which I have seen, so, and that gave me a learning that two treatment together is something we should avoid to keep ourselves safe,
Absolutely.
and rather than just following one particular treatment with all faith, positivity, and of the healing mood. So apart from the treatment, as we were also earlier talking about the reversal of diabetes, I have seen there are people who have said, I don't want to take any kind of medications. I am fully motivated and very positive towards the lifestyle, and I know within some time I will be able to reverse it. So they were in the pre-diabetes stage, and they were following the healthy lifestyle, and they were happen to like reverse it very beautifully, very
Yes,
beautifully. So
absolutely. Absolutely.
mindset is
But
something which
see,
is
that's what. So if you're in the pre-diabetic stage, you can only with lifestyle reverse your
yes,
diabetes. But if you have very high sugars, you can't do that. If you're in a
yes,
stage of weight loss, initially you're going to require medication. Later, as the sugars normalize, then, with lifestyle and all, there is a chance that the medication may stop.
true that.
But yeah, it depends on the level of blood sugars. Absolutely.
All right. So this brings the another question. Can we skip allopathy and have only Ayurvedic medicine? So I guess ma'am has already answered. She can't comment on Ayurvedic much. But yeah, whatever you believe and whatever is working out for you would be a better option to choose on.
As long as your sugar is under control and you don't develop any end organ side effects where your organ gets damaged,
True that.
use whatever way of medicine as long as your sugar is getting controlled. But when I mean control, it means your HbA1c should be 6.5,
Yes.
not just be 200. That's not control. So A1c
Yes.
of 6.5 is a good control of diabetes.
True that. People get excited by just getting the fasting and post meal sugars in control. So that's not something we should look for.
I get,
HbA1c.
yeah, I get patients who come to me and tell me last week my sugar was 300 and then I started this powder and now today my sugar is 270. So by 30 my sugar, it doesn't work. It is not like that. It doesn't work like that, you know. And then they'll never check for the next 6 months because they're so happy that the powder is working
I
that
know.
they don't check their sugar. So I'm not against any method of
Yes.
medicine, just that you make sure that it's working for you. If it's working for
Yes.
you, continue. No problem.
Yes. True that. True that. We have some more questions. Yes, diabetic patients के wound ठीक करने के लिए क्या food items avoid करने चाहिए और क्या खाने चाहिए? So I guess I should address this question. For wound healing, vitamin C is something we should definitely incorporate. तो चाहे आप सप्लीमेंट से लो या फिर नेचुरल फूड सोर्सेज से, जैसे आंवला हो गया या फिर लेमन हो गया और सिट्रस फ्रूट्स हो गए. So including all these things is very important. Apart from these, this is something I'm talking about the functional food, but you need to follow the other lifestyle aspects as well. Managing stress, that's something really very important, because when the patient gets like food and they see that it's not healing, they are like truly anxious and stressed. So that's something you really need to manage it well. Apart from that, having a balanced diet is something very very important. So putting enough amount of protein for the wound healing is the important macronutrient which we should consider. Apart from that, the omega 3, omega 6, all these things are really going to be helpful to get the speedy recovery of the wound. And but I would say, along with all this, visit your doctor and get the change in your medication. You might need the insulin also that particular time to get the speedy wound recovery, but don't just get afraid of the insulin. So I would just ask you, ma'am, to like throw some light on the insulin treatment, because there are people who get the insulin treatment for a particular duration, for a short duration, but they are anxious. they भी हमेशा एक बार चालू हो जाएगा तो हमेशा इंसुलिन चालू हो जाएगा. तो ये जो डर है उन लोगों में, so is it like very true, or it's something can be for a temporary duration?
So in many cases, we give insulin only for a temporary period, especially when the body has some kind of an infection, because insulin one is the safest in terms of when you say all the diabetic medications that are available, insulin probably is the safest and the
Yeah.
most effective, the most potent. So if you have a blood sugar of 500, the only medicine that will work to bring your sugar down is insulin.
Insulin,
Plus, it
true
has
that.
been seen that insulin helps with wound healing. Insulin helps with the faster resolution of infection. A lot of people think that insulin, because it's an injection, is addictive, but insulin is not addictive. आपको उसका आदत नहीं लगता है. Insulin, in fact, एक hormone है. It is not even a drug. Okay.
Mhm.
आपको इंसुलिन जिंदगी भर कब लेना पड़ेगा? Okay. So you have to understand that insulin, if I'm giving to you at a stage, जब भी आपकी body, when your body is not producing enough insulin, that is the time when insulin will have to be continued lifelong. But if I'm giving it to you for a temporary period to tide over some high sugars or to tide over some infection, then it is very, very unlikely that the insulin will have to be continued lifelong.
True. Hmm.
So insulin is not responsible for you having to continue insulin lifelong. It's because your body is not making enough insulin that at that particular point in your life, you have to probably continue the insulin.
Yes, true that. So, drugs are the mimicry of how the pancreas work and how we get the insulin. Whereas insulin is something, जैसे हमारे body के अंदर naturally insulin produce होता है, वही चीज हम बाहर से दे रहे हैं externally to manage it really well, and that's how we get a very good control with of the sugars with insulin treatment. So that's something we need to keep in mind. नॉट गेटिंग अफ्रेड कि ये हमेशा हो जाएगा, हमेशा के लिए मुझे इंसुलिन लेना पड़ेगा. So that can be for a temporary duration and for the best or the better treatment outcome we wanted it, and that's how we landed up into the insulin treatment. So yes, one more question we have got is, what are the scientific terms that are put on packaged foods which causes diabetes?
Okay, this is more of your area, but I'll just introduce the topic. Is one is that all of us should learn how to read food labels,
Yes,
because the food industry is very, very smart. So we have to become smarter than them. Okay.
true that.
Second is there are a lot of misnomers, you know, they use a lot of loopholes. So something that they claim sugar free may have a lot of fat.
Yes.
Okay. May have some source of fructose. because the taste kahan se aayega? The taste
हाँ,
kahin se to aayega na in that. Second is that everything that is written on the front of the packet is is not always to be taken for face value.
true.
So reading of food labels is very, very important, and maybe you can highlight more about that.
Sure, sure. So, as it is asked specifically for diabetes, as ma'am said, they claim that it's sugar-free, but actually there are different forms of sugar which have been added, like maybe sucrose or fructose or something like that. So, but it is not actually sugar-free. That's something we need to turn around the packet and read it wisely, that it's not actually sugar-free. There are other things also. Maybe they claim that it's made with whole wheat flour, but it has been shown that they add the refined flour. We need to see the maida ka quantity in it. So it's not something what they are claiming in the front of the pack. It's included in the packet food as well. We need to check it behind and read it very wisely, that what ingredients they have added it or how they have manipulated it. They claim it is as sugar free, but there's some or the other form of sugar which is already added in the food packet. So that's why I would suggest, in the bottom line, avoid packaged food, go for the natural and the raw ones. That's something we should choose for. Probably the organic ones would be the great idea to go for, because we don't know how much chemicals and all they have added it in the natural foods which we claim it. But we need to look for the alternative healthy options around us. And yes, I would say that try being creative, develop the things which you like in a very healthier version. There are a lot of people who like pizza and all, but they are making their own pizza at home, which is quite very healthy. So I would say that rather than outsourcing the food, make it by yourself and then just include it, because you know what kind of oil has been put in on it, what kind of vegetables and what kind of ingredients you have basically added in your dish. So that's something you already know what's gone inside, and that you already know that that's something you're going to eat and put the information to your body. So the bottom line is go natural, raw, real, organic.
Very nicely summarized.
Yeah. So I guess I'll just check if we have any other questions. And so yeah, we have addressed too many questions um, already, and they are sort of repeated. But I hope, does anybody has any other questions? All right, ma'am. Address most of them, and I am so glad to host this. I think you have your patients also to attend, so we can just wind up here. And I would request you to, like, we can connect soon again for more such informative live sessions for our audience. And thank you so much for taking out your precious time on Friday evening. Uh, and addressing our audience. And in this, specifically this awareness, diabetes awareness month, where we are focusing on awareing more and more people about diabetes and busting the myth, of course. So thank you so much for your precious time, ma'am.
Thank you so much for having me. I think I thoroughly enjoyed this live session. It's very rare that we get to have a discussion. Usually we are all
Yes,
either giving a monologue or listening to somebody else. So this was very interesting where we could answer everybody's questions and dispel a lot of myths. Thank you so much.
thank you so much, ma'am. It was pleasure to have you, and we shall connect soon. Thank you so much to all the audience who have joined.